Hi there, it's Justin Lubino again with Senior Advisors. And now that the annual enrollment period is over for Medicare, we've got some time to really dive into some of the news that's going on with Medicare. And since the election, there's been a lot of discussion around what's going to happen next year with the Affordable Care Act, and Medicare has been bleeding into that discussion and what the changes might be for the Medicare system as well. And a lot of what we read right now has to do with privatization and this proposal called A Better Way, which really outlines a lot of different recommendations for not just Medicare, but a lot of government systems. And I wanted to take some time here and create this short video to really explain what are some of the things that are being recommended in A Better Way, and some of the changes that may actually get pushed through, and what my perspective is on some of those changes. This video is a short video. I'm trying to keep it to about as short as possible for a quick summary. So first of all, if you just do a quick search in the news and Medicare, and you see this in all over the papers as well, Paul Ryan's name comes up a lot, and some of the things that he's looking to do with privatization of Medicare. And I just wanted to kind of talk through what that means and what the impacts may be of some of these changes. So I actually read through A Better Way, and it's a 37-page document. I didn't read all the sections, but the sections related to Medicare, it starts page 30 to 30 Better Way. It's been highlighted in the Medicare Trustees Report and the Congressional Budget Office reports. I think we all are aware at this point that the system is not sustainable in its current, based upon the current rules that are set up. So some things have to change. Some of the recommendations that are recommended in A Better Way are in this table on this slide. There's 5 ones that I want to talk about just for the sake of time here, what I think are the most important changes that are being recommended. The first one is strengthening Medicare Advantage. The second one is Medigap Reform, and I've tied these two together because they're very related to each other. Number 3 and 4, I'm going to talk about a premium support and Medicare Compare. Also, I think very tied together. And then number 5 I want to discuss is the matching of the Social Security retirement age. So again, there's a lot of recommendations here, but the 5 that I'm going to discuss in this video, which I think are the most impactful, are listed here. The first one is strengthening Medicare Advantage. And this was a bit of a surprise to me, but the footnote and the data point that's mentioned is that seniors are overwhelmingly approve of the quality and service they receive from Medicare Advantage plans. I did go to this actual report, and I found it's an 88% satisfaction rating for Medicare Advantage plans, and it's a legitimate source. So across the country, it seems that overall there's a decent satisfaction level for Medicare Advantage. The second recommendation is Medigap Reform, and I'm going to talk about both of these, Medicare Advantage and Medigap Reform. But the reform that's being discussed is really, the intent is to basically weaken Medigap coverage, so it's not as robust as it is today. The theory is that people spend a lot more on their medical benefits if they have a Medigap plan because it's such great coverage. And so I went to the source that was being referenced in A Better Way, and I found 3 interesting data points, or 3 interesting studies. One indicated that low-income individuals in poorer health may forego needed health care if cost sharing increases. So the proposal in A Better Way is to basically drive more costs to the beneficiary, so more out-of-pocket cost, so they're not as likely to use the medical services. And the studies that were being referenced indicate that low-income individuals basically would then not fully utilize services when they may need it. So that's one interesting data point. I don't think that's a good thing. The second thing is that secondary insurance was not associated with higher spending for emergency hospitalizations. The reality is the hospital insurance fund is the one that's running out of money for 2026 or 2028, depending upon which report you look at. And that's the one that we need to really look at the costs associated with. Part B spending, although it's high and it drives up your premiums each year, is not as urgent of a need, when compared to the hospital fund. And this study is indicating that basically increasing the cost sharing to the beneficiary will not impact the hospitalization spending. If you have an emergency, you're still going to go to the emergency room. So it's not really solving that problem. The third interesting point I found was the actual savings that would be estimated by the CBO was about $5 billion a year. Which is a big number, but it's still less than 1% of the total Medicare spend. each year. So, this Medigap reform that's being suggested would save some money, but I don't think it's dramatic. Now, when we compare the public to private options, and this gets into Medicare Advantage and Medigap, a better way is basically trying to shift more people from the original Medicare, which is the public option, to a private Medicare Advantage plan. If you look at the customer satisfaction, they're all pretty good. There's not another government program out there that would have satisfaction levels this high. But it's, Medicare Advantage we saw was 88% and up to 92% for Medigap plans. If you look at the average cost to the government for each of these options, original Medicare costs the government about $12,000 per year per beneficiary, where Medicare Advantage costs about $10,000 to the government each year. So the government would save about 20% of their expenses if everyone moved from original Medicare to Medicare Advantage. It's probably not realistic, but the point is there are savings to the government if this shift happens. The average maximum out-of-pocket limit. So this is now what's the exposure to the individual. With original Medicare, there's no out-of-pocket maximum. So if that's all that you have, there's no cap on how much out-of-pocket expenses you would have medically. If you have a Medigap plan, most people have a Plan F Medigap plan, which has a zero out-of-pocket expense for any Part A or Part B services. And Medicare Advantage, the average last year for out-of-pocket expense maximum was $5,223. So the government cap is $6,700, but the average was over $5,000 for maximum out-of-pocket. So there's a lot more exposure on a Medicare Advantage plan than if you have original Medicare with a Medigap or secondary plan. And then as far as the network goes, with original Medicare, you can go to any doctor or hospital in the country that accepts Medicare. This does include the top 20 hospitals in the country, according to U.S. News and World Report. All of those accept Medicare. Where Medicare Advantage are mostly HMO plans, where you have to go to your doctors and hospitals in your service area. So if you want to go to the best, hospitals in the country, you'd really have to be on original Medicare to be able to go to, the specific hospital you want to go to for your condition if you get something serious. So two very different paths. Clearly, the government would save money if more and more people shifted from original Medicare to Medicare Advantage. That said, it's a significant impact to the individual with their out-of-pocket expenses, and also the doctors and hospitals they'd be able to see with a Medicare Advantage plan. So my perspective is, not to have significant reform on Medigap. If you want to continue to strengthen Medicare Advantage, I think that makes sense. But I think the reform suggested for Medigap would not be a good thing because it would impact the satisfaction levels and more out-of-pocket expense to the individual. And also, if it does shift more people to Medicare Advantage, they'd have less quality care than they would with original Medicare. The third recommendation in the better way that I want to talk about was premium support. And this one, I am truly just not understanding what this is about, because essentially this already exists today. So I don't know what's different is being recommended here. Essentially, the way Medicare Advantage works today, if someone selects a Medicare Advantage plan, the government pays a premium support or a support payment to the insurance company that handles the Medicare Advantage. It's about $1,200 per month that the government pays to the Medicare Advantage plan. So this already exists today. I'm not clear on what the changes are and why it's called premium support, or I don't know, how different this is in the current terminology. But the bottom line is I don't see the value in this because it seems like it's something that already exists today. The next recommendation in a better way was the Medicare Compare tool. And this concerns me quite a bit. There's already a site for Medicare.gov that allows individuals to shop for Medicare Advantage plans in their zip code, and it could be enhanced. There's more changes that can be made. We can fix the quality metrics. I agree with all that and continue to enhance it, but I don't agree with creating a whole new Medicare Compare website, especially after what we saw with healthcare.gov costing over $2 billion, numerous issues when it initially launched. So I'm not in agreement that this is really a cost-effective or value-add solution for Medicare Compare. The fifth recommendation, which I wholeheartedly agree with, is to match the Social Security retirement age for Medicare. A little concerning is that there's only 3 sentences mentioned in this entire 7-page section on Medicare for a better way, considering this is, I think, the most important change that has to be done as soon as possible to help save the system money. And again, it's not going to affect people that are, 63 or 64 or even 58. I think the cutoff would be 54 would be the first group that would be affected by this type of change. So you have time to plan and prepare that you won't get it at 65, you'd get it at 66 or 67. This would save, I'm estimating, about $50 billion per year. Again, these are high-level numbers. This would increase over time as more and more beneficiaries would be aging in. But rough numbers, if 2 million people aging in each year to Medicare, which is a ballpark figure, and the cost is about $12,500 per year, you're looking at about a $50 billion a year savings. So remember, the Medigap reform that was suggested would only save about $5 billion a year in the cost-sharing changes, where this is going to save about $50 billion per year. And again, there's only 3 sentences mentioned on this change, where the Medigap reform had several paragraphs, and I think we should be pushing this one harder than some of the other changes in that document. And the last one I wanted to mention is not even mentioned in the Better Way, but drug price negotiation. We spend about $90 billion a year right now on drug costs. The federal government does, that is. And we're not permitted to negotiate the Medicare pricing for prescription drugs. This, to me, doesn't make sense. We live in a capitalist economy where negotiation should be allowed. I understand this is a political hot button, but I do think it needs to be addressed. And even if we could just get a 10% savings, you're talking $10 billion a year. And I think that's very conservative, with a standard negotiation or to get a 10% savings should be very reasonable. So I think that's a huge opportunity for savings. So in conclusion, Medicare is not financially solvent. I completely agree with that. And some changes have to be made. What I agree with is the age of eligibility change. I think that's a huge savings opportunity. It needs to be done soon. The longer we wait on this, the more impact it's going to have on the folks that are getting closer to that age 65. Negotiation rules need to be added, some sort of negotiation for those drug costs. That I'm estimating about $10 billion a year in savings. Again, both of these numbers are very rough numbers, but it's just orders of magnitude to give you an idea of what the opportunities are that are out there. And I think these two are must-haves. And then the provider payment structure, fee-for-service traditionally needs to continue to evolve to more of a quality-based structure. I'm not an expert in this area. I'll be the first to admit it. But I do understand that this has to continue to evolve to drive more towards quality and less towards just fee-for-service. Things we shouldn't change. I don't believe in the cost-sharing changes that are being suggested. Yes, it would save about $5 billion a year. I believe the negative impact of this on the beneficiary and as far as the network of doctors and hospitals, if you leave a Medigap plan into a Medicare Advantage plan, the negative impact for care would be significant. And also the out-of-pocket exposure may drive people not to go to the doctors or hospitals, as you saw from the study that was referenced. I don't agree with the Medicare exchange being built. A brand new website doesn't make sense to me. It's a very expensive suggestion, and we saw in the past, frankly, the government wasn't able to implement cost effectively with healthcare.gov. I don't have any confidence in this recommendation for a Medicare exchange. For premium support, I don't understand this recommendation. As I mentioned, it seems like this already exists today, so I'm not sure specifically what's being suggested with the premium support proposal. So in a nutshell, that's my perspective on what's being suggested for Medicare. And if you want to get involved, definitely reach out to us, reach out to your congressman with your viewpoints on these changes. And again, we're going to do what we can to help push for some of these changes and hopefully prevent some of these changes that we don't believe in. If you have any questions, you can reach out to us, or you can subscribe to us on YouTube or like us on Facebook for additional updates in the future. Thank you and have a great day.